Hey everyone. We are going to get started with our next career lecture, which is careers in therapeutic exercise. So I'll go ahead and share and we can get started. So, first, let's understand what exactly is therapeutic exercise. We're going to look at the different opportunities in this field in rehabilitation, such as physical therapy, occupational therapy, athletic training, the purpose, types of work done here, and then the educational requirements that are necessary to get into this field. So first, like I said, what is therapeutic exercise? We kind of see this definition, systematic, scientific application, exercise and movement to develop or restore. And so those are the two key words. We're either developing something that was never there in the first place, or we're restoring something that we had that was lost. It could be anything from cardiovascular health, neuromuscular coordination, strength, endurance, flexibility, or any other health or performance factor. The overreaching goal is to improve quality of life. And so we're just trying to either improve or restore someone's quality of life so they live a healthier, more satisfying life. Rehabilitative therapy versus habilitative therapy without the RE at the beginning. These two definitions, you have to know the difference between. Rehabilitative, we're restoring something that we previously had that has been lost. So we've already acquired it. We had this skill, we had this function, but it was lost either due to injury, disease, or something that took it away. And we're trying to get it back. Versus habilitative is we've never had this skill or function in the first place. We're trying to acquire it, and this skill or function is considered normal and expected for that individual of a certain age or status. So, examples of rehabilitative. So, this is what we are trying to get back. So, we had a musculoskeletal injury and we're trying to restore like flexibility, or we're trying to restore like muscular strength. We had an athletic injury, and now we're trying to restore like the function of the ankle or the knee or the elbow. Post-surgical trauma, think about with surgery, we have scar tissue, we have nerve damage. We're trying to repair that so we can get back to our normal function. Cardiopulmonary rehabilitation, maybe we had COPD or some other emphysema or something related to the lungs or the heart, and that impaired our physical function. And now we're trying to get that back with therapy. Older populations where they had some level of function, but they've lost it due to old age. Well, we're trying to either restore it or make sure that we don't progress any further in that whatever we've lost, or in that disease, or in that um, whatever condition that we're in. And then psychological disorders could be anything that affects like the brain, where we were once like a healthy, sound mind, but now we no longer have that ability or function. Versus habilitation without the RE means we never had this in the first place. This could be general fitness, to where I am so sedentary that I don't even have the general fitness levels of a normal person. So we're trying to gain whatever is expected fitness-wise for a normal person of a certain age. Obese populations maybe have been obese their entire life, overweight, obese their entire life, and they've never been at a healthy weight. So that's the healthy weight is what it is expected. So we're trying to get them to that healthy weight to meet that expectation. Children with developmental disorders who were born with such disorder and they've never been like fully functioning at for a certain age. And so we're trying to get them to that stage where they should be physically, such as they should be crawling, they should be walking, they should be pulling up on things. And so, due to that disability or disorder, they were not able to do that. And so, we're using therapy to get them there. And then, specialized habilitation is actually really unique. It's someone who is actually at the standard level, but they want to be above where the average population actually is. So, specialized habilitation is like exceeding the norms. For example, somebody who is trying to run a 4-minute mile, which is very rare and few people have done this. And so hiring a coach or trainer, someone in rehabilitative or habilitative therapy to get you to that like elite performance standard, or someone who's trying to do, again, something just like insanely physically active, but above where like normal people fall. And so that one is unique, but it does still fall in this category. So these are settings. Obviously, inpatient would be a hospital facility. Outpatient clinics would be like your physical therapy clinic that you see, that's not associated with a hospital. Sports team setting, like athletic settings, and then like a private practice, which could kind of be any of those. What I would do is think about what type of population would you like to work with? Who are you interested or what clientele are you interested in working with? So just kind of scan through these and just think about what field do you see you're in, even if it's not in rehabilitative or therapeutic exercise, think about if the which population that fits you the most. All right, so talking about credentials. All these credentials, they very overlap and they're constantly changing. So you do need to keep up with this. Pay careful attention to what your future employment is requiring of you, standards of education, licensure, etc. And one thing to understand is make sure you have a strong science background. Make sure you have active clinical experience, which you should get through your graduate school programs. And then sometimes in your undergraduate programs, just make sure you're taking the required prerequisites, and most of those will be science-based courses. All right, so first one we have is a clinical exercise physiologist. We talked about just a basic exercise physiologist in the previous lecture, but this one is clinical. So with the clinical, we now have clinical patients instead of just like your healthy special populations. We now have clinical clientele. Cardiac, pulmonary, and metabolic disease care is kind of the biggest part of this certification or this job is working with those who are either post-surgery, post-disease diagnosis, and you're working with them to alleviate, recover, rehab, whatever they have going on. You're trying to increase long-term physical, social, economic independence of patients, which is kind of like the overreaching purpose is making sure they have a high quality life and that they are able to live a independent life how they want to. We do this through patient education, behavior change, and then prevention. So exercise testing is something that you would do in the very beginning. You would also prescribe exercise and then administer the program, monitor them throughout, and then prescribe at-home exercises that they would do. How do we do this? You do have to have a master's degree. Well, I take that back. You should, it's preferred to have a master's degree. You only have to do 600 hours of that hands-on clinical experience in a hospital or inpatient, outpatient clinic. But if you have a bachelor's degree without the master's, you have to double those hours, so 1,200 hours of that clinical experience. You would submit an application to take your exam. This exam is offered through ACSM, American College of Sports Medicine. It's the CEP. You can go to this website here at the bottom, and it tells you all about how to register for this exam and how to go through that process. Pay range, I think, is pretty high. It's pretty on the good side for just having a master's or bachelor's in kinesiology. Obviously, the salary varies based on what you see, education, certification, skills, etc. And then there's always job growth in this field, so you'll see that growth. Next is understanding how can we prepare for certification. These study tips are important not just for this exam, but any certification exam that you plan to take in the future. Is obviously creating a timeline. So register for the exam. When do you plan to take it? How long do you plan to prepare for it? They have content outlines online. It's like this blueprint of exactly what you're going to be tested over. So printing that out and making sure that you know everything that you can be quizzed over is really important. They have textbook recommendations, which ones are the actual study guides and which ones are supplementary. I found what was really helpful were the Facebook study groups because they give you tips, they give you kind of guidelines, they tell you how long they studied, they tell you if they passed and failed and what they didn't study and what they should have studied more, etc. They also have workshops. Usually you have to pay for these workshops. um, where you can go somewhere and have like a 2 or 3 day workshop to where you sit, and it's kind of like a quick course that you take, and then usually you take the exam right after, but it's all fresh in your head, ready to go. Another thing I liked was the practice questions. These practice questions, you can get like apps on your phone, and they have like apps that you could probably pay for, and you can study these, but sometimes you can purchase other like practice questions that you can download. So there's so many different resources for studying. And these are, like I said, not just for ACSM exams, but for any certification exam you take. Next is an athletic trainer. Athletic trainers, they work with sports injuries. They help to prevent injuries, they manage and help athletes recover from injuries. They also work with improving performance so the injury does not happen again. They work with doctors, they work with a team um, to help make sure that the athletes and the coaches, everybody is aware of kind of what's going on with their athletes and their injuries. And they usually help with some sort of training sessions, and they help with at-home treatment plans. They actually do a lot more than kind of what we think they do. They have this, or they work emergency responsive care, which is anything from doing CPR to just taping ankles. So they can address like current injuries, concussions, strokes, cardiac events on the field, to asthma attacks, to a broken bone, to a torn ligament or tendon, heat stroke. Like I said, they do all the things. And so you can kind of read through and kind of see exactly what the scope of an athletic trainer is. Here are some other things here. Clinical exams, diagnoses. Usually they would send that off. They would have like an idea of what the diagnosis is and then send it off to like an actual sports physician or sports medicine doctor. They can do therapeutic interventions. But like I said, they work with concussions, asthma, diabetic emergencies, heat strokes, spinal injuries, and then sometimes we see cardiac arrest where they have to know exactly how to do the CPR in order to bring that patient back. This little YouTube video down here at the bottom is another great resource to see what athletic trainers do. So how do we become one? Um, you do have to have a master's degree to go to athletic training program. And so obtain bachelor's, master's degree, and then get accepted into that graduate program. Clinical internship practicums, you have to pass a BOC certification, obtain a license, maintain that certification by doing continuing education requirements, and then seek employment. There's lots of different opportunities for athletic trainers rather than just sports teams. If you watch that little YouTube video, it shows that you can go work for Circus, why can't I say that? Cirque du Soleil in Vegas. You can also work for like Broadway in New York. You can work for the American Ballet Company. You can work for military. There's so many different areas that you don't normally think of outside of just like sports in high school, or any type of collegiate athletic training opportunities. They're very broad actually. And so look into all those different areas in which you can go into if you want to become an athletic trainer. Sadly, the pay range isn't what you would expect. Obviously, it's higher. The more certifications, time in the field, and different settings for employment, but most of the time, those high school athletic trainers don't get as paid, I think, as much as they should. But growth is always high when looking for an athletic training position. Here is this program, the Accredited Program Commission for Accreditation for Athletic Training Education, and then kind of what their scope is. Again, just kind of all the things that you would have to know or know how to do. Here are some other resources that looks at athletic training. There's Journal of Athletic Training, Athletic Training Education Journal, and then NATA is where you need to spend some time looking. So this website has everything you need to know about the National Athletic Training Association. Next, we're on to occupational therapy. So with OT, they are different than a physical therapist, and we'll talk about how we can differentiate them. They help with functional challenges that have occurred from illness, accidents, injuries, and they are trying to help improve their patients' daily lives. They work on not just physical, like a physical therapist, but they work on emotional and mental disabilities to either restore or develop. So it can be habilitative or rehabilitative. Again, trying to help their patients or clients to get back their independence. So this video down here at the bottom helps to show what our occupational therapists actually do. So we see up here all of kind of the entire scope of an occupational therapist. I said athletic trainer, didn't I? On the last slide, occupational therapist. Activities of daily living. Our ADLs have to be performed at a high level in order to have independence. And so they really focus on that. Another thing they do is problem solving through memory tips, through different practices, different games in order to solve a problem that they're dealing with physically, mentally, emotionally. They could teach people how to use adaptive equipment, anything from like a prosthetic or some sort of aid that they may need for walking or being active. They work with patients to make sure their home is safe. They help them return to work or school, whatever activities that they're trying to do. And they also train their family or caregivers in order to help them create a, independent life for that person. Some of the things that we see is teaching new ways to do a task, maybe that they can't do it a certain way, that maybe the normal population would be able to do it. That's where the problem solving part comes in, being really creative and teaching their patients to be independent and do a daily task that they need to. They could create daily routines that help with independence. They could also do stretching, strengthening exercises. You could specialize in OT and the physical rehabilitation part, anything from gerontology, pediatrics, mental health. Here's another YouTube link at the bottom that shows more about what an occupational therapist does on a day-to-day activity or day-to-day schedule. Job or pay is high. This is OT and PT have one of the highest pays in the rehabilitation field. Work environment, hospitals, physician offices, schools, home healthcare aides, nursing care facilities. So there's lots of different opportunities to go into for occupational therapy. You need your bachelor's degree. You complete prereqs, even if it's not required for that degree program. You'd have to complete some other courses. Observation hours are necessary. And then you would apply to a program, a master's or a doctorate program. Most all programs are moving to a doctorate. It may not be like, it may be in a few years to where they're all doctorate programs. They still have a few masters. And then you would pass this board exam, this board certification exam right here, and then obtain your state license and find employment. Next is a physical therapist, like we know is very similar to occupational therapists. They work mainly just on physical rehabilitation and they don't address any like more of like the cognitive, the mental state, emotional, any of that stuff. They mainly just work it on physical. Main goal for PTs is just trying to reduce pain, improve mobility, improve function. They can do it in many different ways, though. They create treatment plans that help with exercises, hands-on therapy, suggestions for lifestyle changes. They do in home or they do in clinic care. They give you exercises for at home. Sometimes they can come into your home to help with this. Common tasks, they have a smaller scope than the occupational therapist. Like I said, they mainly just work on the physical side, diagnosing, determining a certain level of function, and then trying to improve that functional level. They do the individualized care plan, evaluate progress, adjust, and then help to discharge the patient so they can go home and do home exercises to improve their overall care. I have some YouTube videos here at the bottom. This one you can watch to kind of show what it's like to be a physical therapist. Some other things, benefits of going to physical therapy. You yourself may have been a physical therapy patient, like I know I have several years in a row. We're trying to improve strength, stability, endurance. For older adults, we want to decrease risk of falling. For athletes, we want to prevent injuries. We want to promote recovery from surgery to make sure that we're returning back to work or our sport at that highest level possible, restore function and movement, maybe for someone who is older, trying to live an independent life and have a high quality of life. And then also prevent diseases and ward off any other disabilities that could affect our lifestyle. Like I said, pay is also high, and we also see job growth. And then the hospital, the work environment are very similar to what we would see with an OT. as you can see right here. But one thing you want to know about both PTs and OTs is it's a typical day shift, like the 9 to 5 job. Weekday work schedule is expected. You're on your feet most of the day. You're seeing clients. Yes, there's paperwork involved. Depending on if you have a physical therapy assistant or a technician that works with you, you're doing lots of hands-on work on your feet and doing paperwork kind of in the clinic all day. Bachelor's prerequisites, hours, coursework, essays, rec letters. Sometimes a GRE is recommended or required. Choose a program. Most of the programs for or I guess all the programs for PT are now a doctorate program, but you may see some physical therapists that just had their master's from years and years and years ago. But now they're all doctorate programs. Licensing requirements, and then pass your licensure, complete a residency, a fellowship, specialize, and then pursue a board certification. So here are some different specialties in physical therapy: geriatrics, neurology, orthopedics, pediatrics, sports. So you can kind of figure out what your niche is and pick a certification or a specialty based on that. And then here are some resources for you. Here's the Texas Tech Health Science Center, where they have the PT and the OT program. The American Occupational or Physical Therapy program right here, the APTA or the AOTA. So all these different resources for you to look into. Last is looking at your certified strength and conditioning specialist. The CSCS I talked about, it's a certification through NSCA. These are very glorified personal trainers that work mainly with sports athletes. And so we're just trying to improve athletic performance through a variety of different ways. We do sport-specific testing. We design and implement strength training programs. So we do like strength training with resistance exercises. We can do conditioning type programs, certified and, or I guess educated on lots of different areas of performance so we can improve that for whatever type of athlete we have. We also have education on nutrition, injury prevention, just like basic health in general, and then lots of different ways to train athletes. This is a certification that I have. But I got it not because I wanted to be a strength and conditioning coach, which a lot of people get for that reason. I got this certification because I teach advanced strength and conditioning at Texas Tech. So you can see here, average salary. It's increasing, but it does depend where you are. So high school, college, university, professional sports, tactical is like a strength and conditioning specialist for firefighters, police, military, anybody, any kind of first responder, combat like that. Independent, private, any kind of overall. It's on the lower side, but it's like I said, it just depends where you work. It depends what level you're at, and then what other certifications you have, how long you've been in the field. But most people don't do this job for the money. They do it because they love working with athletes and they love strength and conditioning. How do you do this? So bachelor's degree, master's preferred. You can submit your application to take this exam in your senior year of college when you submit your transcripts. You also have to have the CPR AED certification. Then you can sit and take the exam. You can see in 2022, 5,000 candidates set for both sections. So there's an XPhys section and there's a practical section. The scientific foundations, I call the XPhys section. You can see 64% pass that. It's on the easier side. So if you have a lot of knowledge on exercise physiology, so if you've taken your XPhys courses, you probably do very well. There is some nutrition in that one too. And then the practical applied section is more of the advanced strength and conditioning type program, the courses that you would take kind of in that field. You see 42 pass that one, and 38 pass both sections together. So you can take one set, or you can take both sections, but then if you pass one, fail one, you can go back and take just the one that you failed. And so that's really nice. There's a lot of rules though and requirements for you to make sure you know like how to set it or schedule your exam, take your exam if you need to recertify or if you need to take another section, etc. This YouTube video at the bottom shows day in the life of a certified strength and conditioning specialist if you're interested in looking at that. Also, if you have any questions about this CSCS exam, let me know, reach out to me, and I can kind of guide you and talk to you more about how to get certified for this one. This looks at all of the occupations we've talked about. The only one we did not discuss was the therapeutic recreational specialist. So don't worry about that one. But the other ones, you can just kind of see habilitation versus rehabilitation. And you can kind of compare and contrast them and see which ones have that type of training and which ones don't. Trends and opportunities in this area, just to kind of finish up, we're trying to fulfill a societal need. We're giving back to society with our expertise in habilitation, rehabilitation, and helping our clientele assist in whatever desired level of fitness they want, regaining lost function. And we work from newborns to geriatrics, unskilled to highly skilled people. And we're just trying to do the best we can out in this world of rehabilitative exercise and rehabilitative therapy. And so that's basically it for this lecture. I hope you enjoyed it. If you have any additional questions, please reach out to me. Okay, great. We'll see you on the next one.